good. All right. So what we're going to do is this. Uh, okay, that's on all those there. So the patient comes in, and what we're going to do is we're going to tell them briefly. We're going to say, okay, before we do the scan. Now you have that brochure also, correct? Of uh, the brochure of, there we go. The substation one. Yeah. So you know what? I'm terrible at typing and stuff. What I'd like you to do, if you could, open that first page of the brochure and just make it 8.5 by 11 of putting those four, four main points, just that whole column of that first page, because it shows it doesn't hurt, absolutely no, it's just receiving information. It kind of really calms their nerves. Why do they do it? Because X-rays show stress to the bone, which then that helps you in a way, since we don't do X-rays because they're not necessary unless you have broken bones, but you don't. With this shows stress to the nerve. Why is it important? Number three, because the slightest amount of pressure, the weight of a dime, could cause 60% nerve dysfunction. And then the last one, why is this important to me? Years people say, why did I get so many adjustments? Why do I have to keep coming back? Well, we're able to make tailor-made program. So those four key points, if they know that, would be very good. Now, a lot of times we can work on this later. We always would say with those flyers, if you hand this out, say I go home and my neighbor, like, I got this cool scan. Well, what's it like? Well, wait, I got a brochure. If you hand this to any family or friends and you said, hey, I got this thing, we could put a free offer on it too, that you can hand that out if somebody else wants a scan. We used to get anywhere from 5 to 10 extra patients a month, just 5 people filling it out. Yes.
This one or this one?
No, I'm
Which
saying no. I'm saying if you that that if you have
Oh, oh, okay. With
yeah,
the four 8.5 by 11 of one through
yes,
four.
yes,
Okay. Okay.
cool. Um, okay. If they share the book, you can say that too. The Health is a Journey book. If they share that, say we can do an exam. I mean, or a free scan. Okay, so what we're gonna do is this. Can you see my screen pretty good?
I can, but you have this meeting is being recorded tab thing right in the middle that needs to hit continue. Or is that for me?
It's probably for you.
Yeah, that's for me. Okay.
Okay, no problem. All right. So, let me post through. Come on, here we go.
I guess we could
Okay. So what I'm going to do is this. I'm going to talk to you, Diane. I'm not Olivia. I'm not cutting you. I'm just okay. So she's a patient. So before I do a scan, what I want to do is I want to go over kind of so you can understand what the scan's all about. We have three parts of the nerves: the motor nerves, motor nerves control your muscles, autonomic, all your blood vessels, organs, and glands, and then the last part is sensory. It's the smallest part. Now let me ask you something, Diane. If if we had, you can see, if you had a nerve, like we're pretending a nerve coming out of your body and going to one of your muscles, and I pinch that nerve with a pair of pliers real strong, what do you think would happen? Think as a patient. It hurt. No. You see here, it would cause tightness, fatigue, spasm, weakness. It would cause that muscle not to function properly, not necessarily pain. If I cut that nerve, what happens? It doesn't work at all, right? Right. So now let's go to the motor autonomic that controls, organs, your stomach, lungs. If I had the nerve coming out of your chest going to a lung and I press it real tight with pliers, what do you think would happen? Now, automatically, they're going. They already said pain. You go, no, it wouldn't work properly. So now you would probably say it wouldn't work properly. Exactly. You could have breathing problems, more susceptible to different kinds of bronchitis and or stomach issues if it went to your stomach. So basically, it wouldn't function properly. So basically, 90% is function, not feeling. Now let's look at the last part, 10%. Um, it's sensory, and out of the sensory, there's communication, position, temperature, and pain. So pain's the smallest part of the smallest part. So notice, it says here, central part. It's a small portion. So basically, I want you to know one important thing. This is the point you want to drive home. Feeling good does not equal good health. Good health equals healthy function. And there was a study, nerve pressure can exist without pain. The House study, 1993. So it's a proven study. So it's just not you saying it. Okay, now let me talk more to Olivia because Diane's heard a lot. What what did
Diane's
I?
old.
Huh? No, you're not
Diane's old.
been
She's been
around.
around for a while.
What did you just learn? Something that really struck you, like very interesting that you never knew before. That I just said.
Like out of this whole page.
Talk loud. I can't hear. Sorry.
Out of this whole page,
Yeah.
probably the last thing you said that nerve, yeah, nerve root pressure can exist without pain.
Right. Okay. You see, and what happens is this. I'll tell you. In our profession, for years, we say it's a true statement. Diane said many times. Pain's the last thing to show, first thing to go. Okay. Now, so so if I try to say, hey, it's been there a long time, you need a lot of care, to me, let's just be honest at asking, it seems like a sell job, right? Oh, you just want me to think it's there a long time. Now they know why, because it existed for a long time. Just like plaque buildup in the heart arteries, it's been going on for a long time, but you didn't have the heart attack yet, okay?
Like high cholesterol. You could have high cholesterol and they don't know until they run a blood test on you.
Right, exactly.
Unless you're cardiac arrest or whatever, but I mean, even then, you don't know what's causing it. You don't know
Right.
yet. So it's that same
So,
exact thing.
yes, exactly, Diane. So, what happens now? It's amazing. They never heard it before. They're like, wow. So we got to what we could say verify it. Now I know you have that one I just saw, but I tell you what, I like this better. Maybe we can upgrade just for cost or whatever. The new gauge. I mean, no, sorry, not the gauge. The new. Come on, where is it? Oh, fart. Hold on a minute. Sorry. Didn't mean to say far. Okay, here we go. The choice versus chance. Okay. See, it's a lot cooler, the new one. All right. Now, so here's what we're gonna do. People are like going, I never knew that. So let me ask you a question. I mean, so look at
This ties in with just that top line, ties in with the stress test that they're doing.
very good. Yes, very good, Diane. So you have a choice to determine the quality of your health or take a chance. So you've had now the stress. You take the stress test. You have chemical, emotional, physical stress has caused your health to decline over time, regardless of symptoms. Okay, from birth, misalignments, degeneration, damage, disease. The most dangerous symptom involves no symptom. Look at this: heart disease, number one killer, silent killer; hypertension, silent killer; diabetes, silent killer. Okay, so don't delay. So basically, the longer time goes on, the more damage, degeneration, disease problems you create, and then boom, your health's going to explode. Okay, so now these here verify what I just said. So then I go like this. If I can, I'm trying to make it real easy here. No, so I go like this. So basically, no, if I do this, I'm going to mess up. Oh, this thing's in the middle. I hate this thing because I got to move. Okay, good. So I go, you have base your health on, and I go over to the poster. Now this is good now because you'll have the choice versus chance here. Then you can, and then I go over. I said you've been basing your health on, and I cover the two big parts on the 10%, and then I slide down and missing 90% of what's going on. Now I did say that, but then I'm going to say this too. Let finish my sentence. Have you ever heard by the time you have a symptom, it's too early or too late? What have you heard, Olivia?
Too late.
Late. See, you need to make them say it because if we just talk, it's like a sell job. That's right. It's too late by the time you have a symptom. So that's why we're more wellness based. Okay. So we're not trying to scare them here. Okay. We're just saying you have a choice versus chance. The longer you wait, the more damage, time, money you create. Well, now if I didn't say this, guess what? They just think it's a chiropractic theory. But now they say heart disease. And oh yeah, Uncle John, he just felt a little bad. He sat down or took a nap, never woke up. High blood pressure. I don't know what the new stats is, Diane. You should check that out. I think like 5 years ago, I keep saying it, I got updated. 21 million people had diabetes in the country, and 17 or 18 million didn't know they have it because, like she said, they weren't tested. So you don't know how your spine is unless you get tested. Okay. Now, what here did you like or didn't like, or kind of made the light bulb go off a little bit? Did that help at all about you don't feel everything by mentioning these different things that happen with no symptoms? Yes, no, huh?
Yes, I like
Yeah.
that.
Okay. Sorry, no, I can't hear you. I don't know if you're saying okay.
I talk pretty
Now,
quiet.
so here's the kicker. Let me ask you a question. Let me see. Oh, it's down here. If you don't feel 90% of what's going on, Olivia, how can you tell if you're healthy or not? How can you tell that 90% is working or not if you can't feel it? What'd you say?
I don't know. I don't think you could.
I'm sorry, I can't hear you. Sorry.
Said, I don't know. I don't think you could.
Very. Now, do you understand how powerful that is? Again, this isn't manipulation. This is just great procedures. So now you don't know. We don't know. So you see what it's doing? It's raising the value of the machine. Okay. So now, this is so powerful. Okay. Well, guess what? That's why Dr. Craig has this unit. We're going to do a scan. He doesn't. He gauges, and again, you have that poster over there, the 90%, and I go around with my hand 90%. Okay, to see how well it's. Oh, this is the wrong one. Sorry, this is one for the mild vision, which I reluctantly made it. We know the colors, so the one that I have, it has yellow, then white, and then red, green. I mean green, blue, red, and then black. So, so basically, the definition of health, according to the World Health Organization, health is a state of physical, chemical. You don't have to read all that. So basically, in the definition, it says not merely the absence of symptoms, absence of disease or infirmities. So basically, it's not merely feeling good. So normal function equals health. The key to health is function. So this is a functional gauge of the central nervous system. Okay, so we're going to gauge that 90% you can't feel to know if it's working properly. What made sense on that one? What, Olivia, what made sense on this one? Talking about the gauge versus guess of the 90%.
That a normal function is a healthy body made sense to me.
Okay, very good. And so now, guess what, patient Olivia? You get to know how well that's working, not only at the present time you come in, but then we're going to rescan you to see how you're improving function of those nerves. So we're not just going to poke, pop, and pray and say, keep coming, keep coming, keep coming, keep coming. Would you like to go to a gym for a year and a half and pay for an expensive trainer and him never tell you, if you've lost weight or inches? No. So we're going to talk. Okay, now here's the important thing, and really get this down pat. If you can't feel 90%, I know you feel like I'm beating a dead horse, but they got to get it. 90% of what's going on, do you think your scan's going to be better or worse than you feel?
Probably worse than you
Probably
feel.
worse, you say?
Yeah.
Yeah, exactly. See, if I don't preface that, pre-frame that, they're gonna yeah, get your mouth on the computer. No. What they're gonna do is they're gonna think, why is my scan? Did you fudge the machine? But now if they don't know, you see, here's the theory. If you can take their legs out from under them, I mean, honestly, not manipulating, like I don't know, then they're more apt to be compliant to us. But if they're standing on the premise, I don't really need it, I'm okay, and they think but we shake in their belief. We should because it's a wrong belief. Okay, so second question: if you can't feel 90% of what's going on, and say you came in for low back issues after the baby, um, I want you to know that there could be issues in your neck and mid back as well. But what people say, well, I don't have any neck problems. Well, now get this. If I don't say that and you show them and they go, why do I have colors up in my neck? It's my low back that's hurting. But it's like, see, I told you the spine's a whole unit and you're compensating up in your neck. So you're starting to create more problems in your spine. Does that make sense?
Yes.
Good, good. Okay. So what we're going to do is along the way, we're going to scan, I mean, not scan, but yeah, we're going to do scans to see how you're progressing so we can gauge you on your journey to health. You know, health is a journey. What did you like about this one?
Um, I'm looking at that one too because the colors.
Yeah, yeah, I'm sorry about that.
Oh, that's all right. Um, I like just how it has like the big words for people to understand, like the key to health is function. I feel like people read like big words like that, and then the normal function is a healthy body. I feel like people read that more than like, the majority of it. And then they look right at the color too.
Right, right. So do you think this three-step process, they're pretty much understanding somewhat, not 100%, they're not going to go, hallelujah, I got it, that, man, I can't base my health on feelings. Okay? Definitely. So, you know, a lot of times too, and I should have back up, but at the beginning, a lot of times the main question, and we should say that, let's note it, um, if, before you even go over all this, just think if you said, if you had, and maybe pretend when, before you even started there, if you had a severe issue health wise uh, in your spine, do you think you'd feel it? What do you think most people say? I mean, before they see all this, if you say, how you doing? They go, I feel great. Say, are you sure you don't have any problems? I don't have any problems, right? So then the end question would be what? After hearing all this, you said that if you felt great, that the majority of the time there wouldn't be any problems. You know,
Right.
you still believe that? And they're like, no, I guess I can have a problem and not know it.
Yeah.
Okay, good, good. Diane,
Yes.
questions, or I mean, or what did you like that maybe you've not been saying, or you forgot when I was there years ago that you kind of like that you want to implement?
In general or about this
Yeah,
poster?
in general, any of the, you might say,
In
oh, well, I've been pretty much saying the same on these two, but this one really struck me that I'm missing saying this or that. What would it be?
Yeah, it's just bringing all of this back and saying it because we're not currently saying it.
No, thank you. And don't worry, I've done this all day long. You guys spurred me on. Well, somebody else wanted. Oh, Mike Gauthier in Canada, and he's like, oh my gosh, I'm not saying half the things, and I'm
Right,
so yeah. So again,
right.
it's just like anything else. Even when you read the Bible, like, oh my gosh, I forgot that. I forgot this, or what
Right.
happened. Okay.
A big question that my staff is getting with patients in this whole the scanning and the stress test, and Olivia's one of she gets this a lot. What is this for? Why am I doing this? So that shows me, wow, you don't realize what's putting bones out of place.
Wow,
And
that's true. That's true. You know, you say
yeah,
this this show, and I think if they read that four things, you know, and then understand that this is showing stress to the nerves. We're a nerve doctor, not a back doctor. These nerves, you know, well, kind of both. But anyways, um, this shows stress to the nerves because the vertebrae, and here's a key. Now listen to this. The vertebrae can look nice and even on an X-ray, and even the curves not that much off, but you can have swelling in the joint causing severe pressure on the nerve and not see it. How many
not seeing
times
that.
I went to and they couldn't find anything, so they just sent me to pain management? Well, because remember the weight of a dime. I said, I think when I was out there, I don't know who I said to. You should have a dime in there. Uh, And if not, you just the slightest, you just touch the back of your hand, very slight, and say that much pressure, the weight of a dime, causes 60% nerve dysfunction. Chung Hao Su, Colorado University. So basically, the slightest amount of pressure, even if it's not vertebral, but it's just a swollen joint, we're gonna pick up the smallest amounts. So if Doc gets 30% pressure off of there, you're not gonna feel it. But you're gonna get 30% improvement. So the slightest amount of pressure, and that's what it says in number 3 on that brochure. So yeah, you see, the pre-framing makes them understand a lot more about, well, why are they doing this? Say, well, unless you're in a bad car accident and fell, or and there's some if
Mm.
there's fractures, we'd send you out for X-rays. But right now, this is more important. And again, you really don't see any change in the structure until you see a change in the nerves, because the muscles hold the muscles are active, bones are passive. So you're not going to get a change in that rotation unless you change the nerve, which will ease up the muscle. And if it functions properly, then you'll be okay. So yeah, so that's why we do it. And hopefully that when you pre-frame them and go over all of this, that this is really valuable. And do say NASA uses this on their astronauts. They test them, all the nerves along the spine. So, and the reason why too, a lot of times, say you have sciatic pain, which is linear of L4, L5, and all that. But when we did testing, we put a subluxation on a rat at T10, and it showed up that was causing, because that nerve goes from the brain all the way down to the toes into the so basically people say, oh, I'll look at
That's
I
what we were
here's what I
saying
do.
yesterday. How could something, we were doing a child, I'm just giving her an example. We were doing a child yesterday and Doc was doing a foot check of a leg length, and something in his mouth caused the leg length to change. And she was amazed by that. How you wouldn't think something out in your mouth or your neck would cause your leg length to change. So kind of that same understanding
And,
that
and
that's
what I
where
always say, too is, Christopher Reeves did not blow out his low back. He blew out C2 and he couldn't walk. So, so that's another thing. People, well, and in general, people who break their neck, they're quadriplegic. And so they didn't break their low back, they broke their neck. So one time oh my gosh, I was in Long Island at a grocery store doing a screening for a doc, and this person had drop foot. I mean, the way they were walking, look at that polio, whatever. So I checked the low back, perfect, perfect. That not a problem. I'm like, oh, I go, oh, Sigafu, C2 or C1. So I checked the neck. It was black. The bars are black, and the neck was causing the low back. So again, we don't just poke, pop, and pray. We don't guess. We gauge. Better diagnosing, better diagnosing equals better treatment program equals better results equal better pizza Papa John's. No. So, uh, yeah. So again, it'd be like saying there's a couple analogies. You know, um, you can have some cavity, some pain on one side, and you can start drilling all the teeth. Does that make sense? Or take an X-ray, know exactly where that. So it's better to know exactly what's going on. A tooth is a great analogy um, when you talk about the nerve, and this is true. A tooth is 90% enamel, 10% nerve. So you can have 60% of your tooth rotten and not know it. Eat a soft biscuit or a piece of bread and your tooth break and go, what? Well, again, until it touches that 10% nerve, you're not going to feel it. So again, that's where this comes in handy to find out what the 90% is doing. Okay. Any questions about that? Do you feel better? Like you feel more comfortable with understanding? Okay. Now, just for kicks and giggles, not kicks and giggles, just because we're able to show, uh, let's see, show you. I'm going to go to, let's see, the next one. Uh, just so you know what these are. I don't want that. So where is that? Okay. I don't know why that comes. I hate when things pop up on my computer and you don't even know. So here's what happens. The W theory, okay? I just want you to know this is kind of when you see it, the W theory, it's real simple. Health is a journey. So when people take the stress test, when did you do anybody lately with stress tests? Any of you, or Doc goes over that?
He goes over we give them to them and he goes over them.
Okay. And he asks, okay. So here's what happens. I'm gonna be real quick on this. So, well, let's use. I think I used you, didn't I, before on this, Olivia? What at what age did stress start in your life, or not? What in childhood years, either emotional, family, divorce, or playing sports or whatever. What when did stress start? Just kind of knowing what you know now. 10. Okay, 10. And when was your
6.
6? Sorry, 6. Okay, thanks. 6. Okay. When was your first adjustment?
I was 21 or
Okay,
20.
15 years. So here's how this goes, just real quick. So they fill in fifth or six, sorry, and then you had subluxations. Your health started to decline. It's a journey. It's a process. And then I'm not going to go into when did you start. Some people say, well, it's 10 or 12. I started having some problems. So, anyways, you have symptom care. Start having a low priority, small concerns. You got drugs, exercise, physical therapy, massage. Maybe your mom took you to chiropractor once or twice, surgery or nothing. So you're now 21 years old in my office. Age started when you're 6. You're aware of it. So that's 15 years. So 15 years this journey's been going on of you compensating with the spine, and we're going to see how 16 years of 15 years of accumulated stress, what it's done. Doc will go over the exam, and he'll go over the scans and say, so 15 years of this. Look at the unhealthy pattern. Okay, now what's going to happen the first 24 visits? It's initial relief. That 10% changes in scans are going to show respond. It doesn't mean they get better. Sometimes they get worse, but when you trace them, like I showed you, the pattern gets better. Chiropractic addresses the cause rather than covering up the symptom and restoring your health. It's a process. So don't freak out if you start feeling good. Then also you feel, it goes kind of like funky, but your body, and I did that before. I don't know. Your body goes like this: wham, bam, 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 bam. Okay. Once you're out of pain, then you stabilize, and all of a sudden now you can start to move up and correct. Most of the healing done when the pain's gone, but people get out of pain and right off the chart. They get out of the office. So it's like the braces are on, they hurt. When the braces stop hurting, that means your teeth are shifting and correcting. That's when they correct. So as they correct, if you keep, coming, and all these dots we're going to scan you to make sure we're on this journey together in the right direction. Then once it's corrected, that's where wellness, that's where you get a retainer, your braces off and they retain for 10 years to retain that. And then you get into, oh, you see, you guys can't see it. I can't. I have your picture, lifestyle of wellness. But let me ask you a question, and this is kind of good for you. Say you never brought your daughter in. So remember, or no, remember when you kind of messed around, just took pills, potions, lotions, and now you're really seriously unhealthy. I want you to know that once Doc gets you out of pain and corrects it, you start going on this up this way in the journey. This will stay hit you like it's not a big priority. I don't have to do that. If I think that way, like I did over here, what happens? Right back down. Okay. Second question, Olivia. If you, if okay, sorry. If it's been 15 years of this journey of you compensating, how long is it going to for us to correct it and get you back up here? How long?
It's not going to take 15 years. I know that.
But it's going to take a while. See, they even say 15 years or a while. Well, exactly. That's why we want you to know. People come in after 15 years and say, hey, just give me an adjustment or two and I'm okay. It's not going to happen. Last question, most important. If it took 15 years for you to finally come in and get this taken care of, are you going to leave that little baby home for 15 years of their life? See, and I go like this with I go, they move right across, and they miss this whole journey. It's the best gift. That's why all new patients, any family member in your family, like your husband, can get a scan to see where they are on their journey. Does that make sense?
Yeah.
Instead of saying, "Bring your kids in," why? No why, no comply. Okay, now
Mhm.
that makes sense. But here's the people who are negative. Um, oh, jeez. Okay, here we go. This way. Oh wait, no, no, this one. Nope. Take that out. Oh, I don't know why this did it. This kind of went to these bars. They never went away like that. So, So, okay. Where is it? Where? That's 4, 2. I need 2. There it is. So, I got to change this. I just realized that today. So, health is a journey. So, there's really 3 choices here. Of course, the journey we just went over, this should be number one. You've got 15 years of stress. I mean, affecting your health. You have some ups and downs, but then we start to get you feeling good and back on the road to a healthy journey. And even when the pain stops, you still keep coming. Continue chiropractic care, exercise, rest, nutrition, water, vitamins, attitude, a healthy journey. That's going on a healthy way. Now, the other 2 choices, and that's totally up to you, because here's some people that there's 2 sides of every coin. You you think, you guys are crazy, Dr. Craig. No, I'm not going to do that. No action. I'm going to just not do this. Okay, continue decline. That's okay. It's your choice. Come in and you see when it says here, pain stops. Okay, pain stops. You stop, and then pain returns. You return. Pain stops. You stop. This is symptom care, temporary patch care. Let me ask you a question, Olivia. In in these 2 choices, is this moving towards healthy or unhealthy? That's
If you stay,
unhealthy.
if you stopped care in either of those 2 areas, is it work? Are you going to continue to get healthy because you've gotten rid of, you're in symptom care. You came in, but you didn't continue care. You stopped once the pain went away.
Yeah, no.
No, unhealthy. Good. So the third sign up here, I want you to know that you see right here, there is no middle road. There's no middle road on this journey. So you either getting healthy every day or sick. Everybody, because what everybody thinks, well, I, I'm okay. Does the cavity get better on its own? Does things that are degenerating get better on their own? No. So there's no middle road. So and so watch this. So what journey will you choose? One, no care, just come in on a temporary patch. And I always use it. And there was a poster, and then probably so on. You ever see them patch a road with the patch? Does it stay? It pops back out. They got to repatch it, repatch it. Okay.
Olivia said they just did that to her road by her house.
Right in front of it.
Oh, yeah, it's not a good thing.
It'll be a pothole again before Thanksgiving. Yeah.
Exactly. So that's what this
Stress
is.
of the tires going over it.
Yeah.
By the stress of the tires going over it, it'll end up a pothole. So the stress of chemical, physical, and emotional stress will make that pothole
Right.
appear.
Right. Right.
Pothole in your spine. Kind of a good analogy there.
Yeah. No, definitely. So you guys can think when you're looking over these things. You don't have to go over all this in the. Um, but I would recommend, and again, because I just want to come down again. No, is that the
With training.
comes in a regular poster and be on that back wall. So for people too that get scanned, you don't have to go over the whole thing explaining it. Is that say so? Basically, they might say, "Oh, my scan looks good, great, yeah." Now the next scan could be bad or could continue up, and then if it doesn't, say, "Well, you see," and I tell you what, that's most people put in the adjusting room. And I was in New York City, and I walked to see Dr. Naran Nathanson. I was in the area, and he goes, "Hey, Pedro," it's about a 55-year-old man, bricklayer. He goes, "Tell Mr. Major where you're on this journey." Now, this seems so simple and barbaric, but he goes, "Oh," he goes, "Senor," he goes, "for the last 8 months," he goes, "I've been bouncing up and down here like a Mexican jelly bean or jumping bean. Sorry, jumping bean." And he says, "And I'm now just this last week, I'm out of here, and I'm excited to move up and get back to being a healthy person." And I go, "Well, what's your stress number?" "Oh, my stress number." I'm embarrassed, but he said 45. And when we were a little kid, I was on the field, and then I did bricklaying. I've been really hard worker all my life. He said, so he put his hand on the dock. So after 45 years of beating myself up, he said,
Oh, no.
that
45 was the number here. No, 45 years of stress. Is that what you mean?
yeah, sorry,
Oh,
yeah,
okay. Okay. Yeah.
45 years. Guy said, "What's your stress number?" Because that like sleep number, this is your stress number. So
Oh, okay. Yeah.
45 years. And when Doc said a year's care, I thought he was going to say 45 or 20 years. So you see when
Right.
you tell, and then they're like, "Wow," so it doesn't seem. But if you go, "Well, I just lifted this. My wife lifted the mattress last month and my back went out. I thought it'd go away. And you're telling me I got a year's care? And then you look at they had, the stress says accident, 5 accidents, they're this, they had, went through 2 divorces, their moms. It's like, wow, all that stress, it wasn't just the one thing. I always say it's not the cheeseburger you ate at lunch that caused the heart attack, It was all these times all over the time. So,
Oh, it wasn't the chicken nuggets I ate at lunch that caused all this weight?
oh, I just smell chicken nuggets and I get fat. So, guys don't have. Oh, I tell you what's my weakness, and I love it is Chick-fil-A. Oh, they're saying. I mean, my wife and I we eat very well that day that we know we're going there. We don't even get the fries. You just get the sandwich and the
Good stuff. Okay, you can leave that open.
oh, it's just great.
We got a
So,
new patient.
oh, okay, sorry. So, any questions?
I don't have any.
Yeah. See,
All
when
right.
when you understand it better and own it, you're going to do much better at telling these people. And again, you're not playing doctor; you're just making sure they get it properly. So, okay, I'm going to end the recording, and I'm going to send you the recording. Okay.
Awesome.
All right. God bless. Take care. Love you.
Thanks, Dave.
Thanks.
Bye bye.